Would you believe that I have been preparing for this lecture for 26 years? Because that seems like a long time to get a lecture ready, but that's how long I've been here, going on 26 years. And from the very beginning of my journey at the Riordan Clinic, I have been exploring how thyroid can impact health. And so today, I get to share that with you. How many of you consider yourself a lifelong learner that loves to learn? Yeah. Well, that's what I hope to convey to you today, is what I've learned to love about thyroid and why you'd think, who loves a thyroid? You know, well, I don't so much love that. I love energy. Who would like to have more energy? Yeah. Well, that's the energy regulator of your body, is your thyroid. And so we're going to be talking today about why would the thyroid not be doing its job? Why would doctors that we've seen maybe thinking that it was our thyroid, and they tested it and they said, no, it's not your thyroid. And yet you read up in your book and you find out, well, you know, I've kind of got a lot of the symptoms of low thyroid. Why is that? So today we're going to go through literally the ABCs. This is almost like kindergarten or first grade thyroid lesson today, but I found that that's, for many people, the missing piece, because there is a lot of confusion about what the different thyroid tests mean, how to interpret them, and how, more specifically, how do they relate to your specific situation. To do that, though, I want to kind of drop back. We still have a few people coming in, and I want to just welcome, how many people are here for the first time at the Rearden Clinic? A lot of people. So I wanted to give just a brief intro to who we are and kind of where we've come from. We're interested in looking at the big picture. We're interested in looking at you as a full human being with many connections to the world and many ways in which the world can impact how your body functions and how your health goes. And so I will be coming back to this diagram. I kind of like to put it up there to give people a panoramic view of many of the things that we deal with. The number one paradigm shift out here, though, is that our true focus is on helping you to create health, whether that's through just a purely educational role, as those of you who are here today just to learn more, or if you come in as a patient, we will do some medical mentoring and help you kind of find your way. We have a wonderful laboratory. We have a tremendous history that we are able to draw from. We're not your normal specialists, though. Most modern specialists are organ specialists. You know, you go to your cardiologist for your heart, you go to your GI doctor for your gut, your neurologist for your brain and nervous system. So I am not really a thyroidologist. If someone would say, well, just because you're talking a lot about thyroid, does that classify you as a specialist? I'm more interested in, as I mentioned, the whole picture, a systems approach, a systems perspective, and that was something that I learned from Dr. Riordan, looking at the whole person, trying to understand how we interact with our environments and how the environment can have an impact upon the way we function. And without taking that into consideration, then you don't really know how to correct the thyroid. You can do things to the thyroid, you can test the thyroid, but what we're talking about today is a thyroid system. So I have to give credit not only to Dr. Rearden himself, but to Mrs. Garvey, Olive Garvey. Really, it took a woman to have the vision for a place like this. And she was committed to nutrition, to the betterment of her family's health. And when she could not find a lab that did nutrient testing, by golly, she said, we're just going to build one. We're going to create one. And it was our good fortune here in Wichita that she and Dr. Riordan teamed up to create what was then the Olive W. Garvey Center for the Improvement of Human Functioning. Later, as more and more people joined our cause, she took her name off the big name, and it became just the Center for the Improvement of Human Functioning. And then just in honor of Dr. Riordan, after his passing in 2005, we shortened it down to the Riordan Clinic. The Center for the Improvement of Human Functioning International was just a bit of a mouthful. And it's been, unfortunately, somewhat of a mystery to people here in Wichita. What is the Riordan Clinic really about? And what we're really about is helping people improve their health. And so, in 4 words, we listen, we care, we detect, and we correct. How about that? We're looking for root causes of chronic illness. We're looking for ways to help you improve your own health. And when Dr. Riordan died, we understood from him that 7 things really stood out as being very important. That doctor-patient relationship, which he shifted it to the doctor-co-learner relationship. He wanted his patients to be active learners and participants in the healing process. But to do that, we've got to look for root causes. That's the identify the causes precept number 2. And to do that, we need the laboratory. We have a world-class laboratory here that is CLIA certified, Medicare approved, been in the top 5% in the last 10 years when they do the inspections. We look at the whole person, we use food as medicine, we cultivate healthy reserves, and we rely upon the healing power of nature. So these are some of the characteristics of the approach that the Riordan Clinic uses. So we're back to this big delta. You all know what a delta is. Delta is the Greek symbol for change. And Dr. Riordan was a psychiatrist, as you probably some of you know. And so you of course know the definition of insanity. That's when you're doing things the same way you've always done them and expect something different to happen. So when you come here, we do ask people to look at their lives and their lifestyles and their habits and their assumptions and their nutrient levels and things like this. And based upon that, we begin to move in an upward direction. This delta is facing up. We're trying to improve on the various green components. And the yellow components are the things that are going to pull you down. And if you're really in the pits, you'll be struggling with chronic inflammation, because every modern disease you can think of, most of them have an itis on the end of it. Dermatitis, arthritis, neuritis, all the various itis diseases. Unfortunately, that's not how we tend to see people. When the people that we see come here, they have many different things happening in their lives that's causing concern. And these are the root causes. And I've turned the delta upside down because most of the people we see have been in a downward spiral. Their health has not been what they had hoped it would be. And the things that are green, or were green in the other triangle, are looking a lot more like yellow. And so today we are going to focus on the point of the spear, the leading edge. And that's why I like thyroid as a starting point for people to begin to understand where can they go, what can they do to improve their basic health. Without energy, it's really hard to improve your health. You need to have adequate energy, and fatigue is the common denominator that so many patients struggle with, and there is no one pill that treats fatigue. You cannot reductionistically narrow it down to one thing. And so, but thyroid's a good starting point in a process of investigation. So that's kind of what we do here. We do SOAP. Any of you who are familiar with the medical doctor's way of recording notes, they're recorded in what's called a SOAP format. And so we've kind of taken that as an easy way to understand our approach at the Riordan Clinic. It's Pathways to Better Personal Health, using this sequence of subjective evaluation by survey. And for those of you that have looked at your papers, there's a blue paper that's got a little questionnaire on the back of it that you can fill out to kind of help you get an idea of how much is thyroid a factor for you. That's a subjective evaluation. The number of points that you tick that relate to how you're feeling may be a suggestion that, thyroid might indeed be an issue for me. But subjective alone is not enough in the evaluation. We need to know a little bit more objectively. What is the science behind this that helps us determine exactly where you are? And indeed, this is what today's lecture is about. It's about the science of objectively documenting thyroid dysfunction. Not just the gland, but the thyroid metabolic system as a whole may be out of balance. And so that's the assessment of current status. And we don't just stop there. We really want to have people shoot for a target. We want to plan to get better. Dr. Riordan's favorite question was, how will you know you're better? We need to set targets, subjective targets, objective targets, functional targets, quality of life targets. That's really what the Riordan Clinic is all about, is helping you achieve a higher level of functioning in your own life. Now, that questionnaire that I gave you is quite extensive, and many people would say, do all of these relate to thyroid? And the answer is yes, they all do relate to thyroid. Now, they can also relate to other systems of the body. But one way or another, you can tie these in to either adrenal dysfunction, or you can tie it into yeast overgrowth, or food sensitivities, or some of the inflammatory conditions that we deal with. But nevertheless, fundamentally, they have a pretty strong relationship with thyroid disorders. Now, if you do a thyroid search, hypothyroidism is the medical name for when your thyroid function is low. If you go ahead and type that into Google, one of the first things that will come up is the Mayo Clinic discussion of hypothyroidism. And they list these, whatever this is, 18 or 19 different very classic low thyroid symptoms. So if you're not sure if you want to tackle that big list, all you really need to do is look at this smaller list, which is in the article that I've written that's in our Health Hunter newsletter. The Health Hunter newsletter is free online anytime you want to check in with reardenclinic.org. The smaller subset is very, very classically low thyroid, but the other symptoms can also be clues that your thyroid may not be living up to its full potential. So this brings us to the reason for the lecture. That was all by way of introduction and orientation. But really the whole point of the lecture is the fact that when people do that search for hypothyroidism, because maybe a family member said, you know, your grandmother had thyroid problems, or you know, your Aunt Susie, she had thyroid problems, and you know, you've been struggling. Have you ever thought about it could be low thyroid? And you say, well, not really, but I guess I could go look it up. And so you get onto Google, and Dr. Google comes up with this list, and you say, by golly, I do seem to have a bunch of these thyroid symptoms. I'm going to go to my doctor, and I'm going to see if he can help me figure out if that's what the problem is. And your doctor, who maybe you've been seeing for quite some time, and good person, good doctor, and he's been trying to help, he or she has been trying to help you figure out why you're tired, why you've got headaches, why you're depressed, you know, all that dry skin, all the puffiness, high cholesterol. And so he says, well, you know, we've tried all these various antidepressants and muscle relaxers and pain pills and fibromyalgia medicines and everything, and you're just not getting better. Maybe it seems like I've checked that thyroid, but let's check it again. Let's just check it again and see. And so what he does then is what? What test does he run? TSH. And someone said T3. We're going to talk about all of the thyroid function tests. So he runs a TSH, and it comes back what? Normal. So you feel kind of foolish, you know, that now if you thought you were a hypochondriac before, now you know you're a hypochondriac, and he knows it, and oh, you're embarrassed, and why do I have all this? And so today, let's see if we can give an alternative ending to that story, besides the frustration that so many people feel when they know they've got something wrong in this area, but the test just doesn't show it. So what I have up here is what I'm going to call an analogy. This is a tourist map of Paris. And every map, whether it's a tourist map or a map of Wichita, it has different elements or different pieces on it. A trail map for a ski lodge. And you know, you can look on this. It's probably a little bit too hard to see. Maybe you can see it at your place. There it's got the Eiffel Tower, and there's the Louvre, and there's Notre Dame. And you say, wow, it's got some of the major landmarks right there. But let's say you're really sharp. You know Paris very well. Does it have everything on it that you would want to see in Paris? Not this map. Well, I'm going to say that I believe, based on my 26 years of being here at the Rearden Clinic, that there's been something left off the map of what thyroid function is all about. I'm going to say, this is not putting your doctors down, because doctors are products of their training. They do what they've been trained to do, and what their mentors have told them is what you need. And most doctors have been told all you need to know if the thyroid is okay or not is the TSH. Now, that's not completely true. There's more tests, and we'll get into that. But basically, the first and major test that conventional medicine will look for is the thyroid stimulating hormone. And so the thyroid stimulating hormone, let's get this one straight, because this already people get confused, because if the thyroid stimulating hormone is high, what does that mean? That your thyroid function is low. And if the TSH is low, very low, the doctor will tell you your thyroid function is too high. So right away people are confused. I mean, what? You mean it's backwards? And I say, well, you have to understand what it is. We have the thyroid here, which is a factory, and we have the brain, which is monitoring the blood system, the thyroid hormone levels, which is T4. We're going to talk about T4 and why we call it T4. And the thyroid stimulating hormone just regulates that. It's just a regulator. So it's almost like a thermostat. If the thyroid hormone goes down, the TSH goes up to try to get the factory to make more to bring the TSH back up again. Everyone understand that? Does that clear anything up for anyone? Just because that's the first major misunderstanding people run into, is they can't understand if they're high or if they're low or whatever. What's going on here? And then if it's normal and you don't feel good, why is this not picking up on the problem? So before we go too much further, let's go ahead and show you my map. This is the map I use, and you've got a copy of it at your place. It's got a lot more elements in it. It's got more than just the Eiffel Tower and Notre Dame in it. It's got other thyroid hormones that are in play that have an impact upon how you feel and how your body functions. Now, when I show this to people, again, I probably talk about this every day, because usually one or more patients come in and we're talking about thyroid. And so this is the map I use in terms of explaining how maybe the TSH alone is not enough testing to really understand how your body may not be functioning as well as it could from a thyroid system perspective. So fear not, we're not going to try to tackle this all in one big gulp. We're going to take it in pieces. So let's just start with one very small piece to begin with. Let's just make sure we understand the ABCs here. So how many of you have taken Synthroid or some kind of levothyroxine before? That's just T4, right? That's T4. Why do we call it T4? Because there's 4 iodines on the molecule of the thyroid hormone. Okay, so probably most of you knew that, but that's good to know. Let's all be on the same page together. So that's T4, and I just refer to it as T4, because then it makes sense to understand T3. T3 has 3 iodines. It's actually the same molecule, but 1 iodine has been removed. And then they changed the name. If you take T3, you can get the brand name Cytomel, or you can get the generic liothyronine, but it's still T3. So that's T3, and you can kind of see where we've got a missing iodine there, where now I've got the red mark over, the red circle over where the iodine has been removed. And that's removed by an enzyme that we're going to talk about in just a minute. Here's the new mystery guy that I think most of your doctors have never encountered and have never been told about. And actually, I had not known about it until about 3 or 4 years ago. Been working with thyroid for 26 years, but I've heard about reverse T3. It was kind of like that mystery person down the block that you finally one day meet them on the street and chat with them and say, hey, this is a normal person. I just thought maybe, I didn't know what this person was. Well, reverse T3 is a thyroid hormone, but there's something very unique about it that we're going to get to. And do you see where the iodine is missing? Let's go back one. There's T3. The iodine's missing on the left. The reverse T3, the iodine is missing on the right. Everyone clear on that? Okay, because that does have a role to play here, so that when you look at these two together, you can see that they are both T3 molecules. When I get to the point where you see it, it's really quite amazing. How many of you never cease to be amazed about how beautiful nature is and how complex and how mysterious and marvelous it is? When I tell you how this works to normally keep you in good balance, you'll be really pleasantly surprised. So these are the two T3s. The bottom one, this is now the one on top. Which one is it? It's the reverse T3, and if you can't remember, it's on the right-hand side. So reverse RT3 is sometimes that's how it's abbreviated, as a small RT3. So it's on the right-hand side. So that's the reverse T3, and the other one down the bottom is just the straight T3. So let's do a little review. I figured, hey, we got to get this right. So where is the T4 in this puzzle? Right up here. Can you all see it? Yeah, it's the top one, because it's got 4 iodines. That's easy enough. So where's just the plain T3? It's the second one, because it's the blank spots there on the bottom left. And so that leaves the reverse T3 down at the bottom, and you would know that because it's missing the iodine down on the right-hand corner there. Okay? So we call the free T3 free when it's not bound to a protein in the blood. Okay, your hormones don't just travel. I mean, some of them do travel free in the blood, but a large percentage of them are bound up to a binding globulin or a protein that acts like a bus or a transport mechanism. And there's an equilibrium between the bound thyroid and the unbound hormones right here. And it's the unbound or the free T3 that's available to your cells. And your cells have on the nucleus of the cells, I call them keyholes. They're like little receptor sites. The thyroid hormone goes in, it travels through the cell and it goes to the nucleus, and there it activates the nucleus to begin making more energy if you've got the right type of thyroid. And there's something that affects that. I'm going to show you in just a second here. So all of these hormones, the ones we're mostly interested in are the free levels. You can get total T3, you can get total T4, total reverse T3, but really what's active at the cellular level is free T3 and free T4. So when I order tests, I order a TSH, a free T3, and a free T4, and then the reverse T3 is by definition a free T3. It's the reverse form, but they just call it RT3, but it is also the unbound form. So what turns out to be really crucial in this whole discussion is the balance between the free T3 and the reverse T3. And this kind of makes sense because these two molecules look a lot alike. Oh, I skipped something. Let's go back here where we were connecting the dots. And notice up here this row of numbers here. So the first molecule was the T4, and it's got an activity level of about 1/4. And when the body converts it to T3, it activates it 3 to 4 times more powerful than what it was. So when the gland is making T4, that T4 is really just a precursor. For those of you that are on Synthroid is a precursor to the activated T3. The activated T3, remember that's this one in the middle, it's got an activity level of 1. So it's 3 to 4 times more potent than your T4. And then, interestingly enough, the last guy on the bottom here, the reverse T3, it has an activity level of 0. It is a blank key. And that is very, very important in terms of how we understand what's going on, because the ratio of free T3 to reverse T3 determines the level of metabolic activity that your thyroid hormones are having in your body. So if this ratio goes down, your energy level is going to go down. If this ratio goes up, you can bring your energy level up. So this is what we call the peripheral regulation system of the thyroid, the overall system, not just the thyroid gland, because the gland is just a factory. It makes T4, and I've got these pictured as keys, and here's your quarter strength, but then there's an enzyme right here called 5' deiodinase. It's an enzyme that takes off that bottom left-hand iodine, and now you have free T3 over here. But at the same time, there's another enzyme at work. It's a sister enzyme, and it's just called 5. There's 5' and 5. And these two sister enzymes are busily making T3 molecules. One of the T3 molecules, the free T3, is the metabolically active one that really gets the engine going. I've been using with my patients, thinking of a lawnmower. At least on the side of my lawnmower, there's a little idle switch. And if that idle switch, kind of like a choke or something, if it's turned down too far, that lawnmower is going. Is that how you feel some days? You know, just like your idle is too low, and so with a lawnmower you can just reach down there and you can just turn that puppy up, and you can mow the yard. You know, it doesn't matter if you got a tall bunch of grass, you want to turn it up. Thank you. So anyway, that's the big difference here, is that the free T3 activates the metabolism. What does the reverse T3 do? It inhibits. How does it do that? Well, it is delivered through the bloodstream. Both of them are delivered on the binding globulin, and then they're in the free form here. Let's see, I better point with this. They're in the free form here, and depending upon the ratio of T3 to reverse T3 on these cellular receptors, that's going to influence your metabolic idle. Are you going to be idle too low? Are you going to be idle too high? And you say, well, why in the world, why do we have this? Why did nature make it this way? And I can give you what many authors have stated they think is the reason why we have this. Our ancestors had to scrounge around for food. They were hunter-gatherers, supposedly. And so as hunter-gatherers, they didn't always get food. Some days there wasn't any food to be hunted, there was no food to be found. They were starving, and maybe they could go for a period of time starving. And if the body's metabolic activity stayed high, if you had the lawnmower turned up really high, you're burning up precious fuel, precious energy that could be stored and saved. And so short term, it made sense to shift the metabolic idle to a slower rate of speed, to a slower idle, in order to conserve energy. And then once the starvation was over, the food was found, or if there was an injury or an infection or something that was challenging that individual, once that was better, then their metabolism would come back up. So we see here that there are environmental factors that can regulate the rate at which the T4 is converted to the T3. In other words, the lower activity thyroid hormone is converted to the higher activity by this 5' deiodinase. But we now find that these environmental factors, which the new modern term is epigenetic factors, epigenetics is the study of how the environment affects the expression of certain genes. And genes are what regulate enzymes, and enzymes are what regulate cellular functions. So we see here that fasting or starvation, stress, infections, toxicity, or chronic inflammation can slow down the kinetics, the speed at which the 5' converts the T4 to the T3. This bottom one down here is T3. So in other words, the speed at which T4 is made into the more active form. So this is pictured in this particular slide. You can see that there's been some kind of a stress or some kind of an infection, and so the 5' has been downregulated. That then decreases the amount of free T3 that's being formed, and so the metabolism starts to go down and the organism conserves energy, and hopefully they survive in that situation. So, but the reverse T3 actually goes up. Why does it go up if this enzyme over here is downregulated or partially blocked? Where is this T4 going to go? The gland is still making T4. It's got to go somewhere. It's going to go more down this pathway, and you're going to get a rise in the amount of reverse T3 that your cells are making. The free T3 goes down, the reverse T3 goes up, the metabolism goes down. It's just simply an act of trying to conserve energy, and it's based upon the fact that the reverse T3 has a T3 configuration. So it fits into the keyhole, but like a blank key, it doesn't do anything. It just sits in the keyhole, but it prevents other T3 molecules from getting into the receptor, and thereby it inhibits the effect of T3 on the cells. So unfortunately, if this goes on for too long of a period of time, what was supposed to be a life-saving survival regulation of the metabolism starts to become a long-term dysregulation. This is the term that's actually showing up more and more now as we look in the world around us and we find all the various factors like toxins and chronic stress and chronic inflammation. These kinds of things will put people into a chronic state of dysregulation. Your thyroid, instead of being lowered for a short period of time, it becomes chronically lowered. That becomes a way of life for you. And it happens slow enough that you might not even realize that it's a big factor until you wake up one day and you say, I can hardly get out of bed. I didn't sleep very good. I'm having constipation. My skin is dry. I'm puffy. You know, it looks like low thyroid, but the doctor says my TSH is normal, and I'm out of energy. And I'm depressed. What is going on? You are dysregulated. That's the new word for sick. You're dysregulated. Your homeostasis is out of balance, and it's almost not a disease. It's really a dysregulation of a normal adaptive response gone haywire. And a lot of times it's not picked up on by just standard testing, because what the doctor's looking for is disease. He wants to see that your gland has stopped working. Your gland hasn't stopped working. You're still pumping out T4. Some of it's still being converted to T3, but a lot more is being converted to reverse T3. And now we have the metabolic homeostasis has shifted to reverse T3. You've got a metabolic imbalance. And unless you measure reverse T3 and compare it to your free T3 level, you'll never know it's there. And your doctor won't either. This concept of dysregulation is kind of a new concept. It's a systems theory concept. It's not a disease concept. It's a systems theory concept. You're out of balance. And so how do you shift it back? You know, that's really becomes the question. So here now we're just showing you this in this one slide. I can kind of show you what I've just said, and you can hopefully see it, because if you can see this, This is the reason why your doctor says your thyroid's normal. Your thyroid may be normal, but your thyroid system can be dysregulated and you can be chronically ill as a result of it. These chronic, I call them the dysregulators. They're up here in the right-hand corner. Stress, there's no lack of that in the world today, is there? Infection, oh my gosh, the hospitals are full right now. Flu, and then there's a lot of chronic fatigue and other chronic infections, Lyme disease. There's no lack of chronic infection in the world. Toxins, 86,000 metabolic toxins have been introduced since I think the 1950s. And so we're living in a world of plastics, metals, pesticides, you know, all kinds of things that could possibly be. And the thyroid is right there. The thyroid, they call these pesticides endocrine disruptors. And the thyroid is one of the big ones that gets disrupted. Inflammation. You know, remember I said just about every chronic medical illness ends in the 4 letters of ITIS. So chronic inflammation sets you up for this occurring. And most people don't fast, but there's a lot of people that are dieting, or if they're ill, they lose their appetite, they don't eat very well. This will then slow it down. I actually learned about this in medical school, but it was called the T3 syndrome, and it was only in the intensive care unit that standard doctors kind of recognize this, that when people are really, like let's say they're in a car wreck, and they're really injured and traumatized, and they can't eat, and they've got tubes everywhere, they go into this T3 syndrome big time, and it's real obvious. What we're talking about here today is a little more subtle, because for a lot of people it happens gradually over time, and a lot of us just think we're just getting old, or man, we're just worn down by all the stress, or we've got something happening to us, and we don't think that maybe our adaptive system has maladapted, and it's backfiring on us. And when we go to the doctor to try to figure it out, about the only thing the doctor can come up with is that you're depressed, and so you're lacking in Prozac, and so that may not be the deficiency though. So this in one slide kind of shows you the problem, and when you say, well, is it just those 5 dysregulators? No, I think I can make a case for this whole list here. High cortisol levels, people who are put on prednisone. Chronic infection or injuries, insulin resistance, the metabolic syndrome, it's rampant in our culture. Diabetes, they say by the year 2050, 50% more of the population will be dealing with diabetes of some sort. Aging, surgery, low nutrient levels, very common with the fact that the diet isn't quite what it used to be, fast foods, convenience foods. The high C-reactive protein, I'm going to show you that in just a minute. I've got just one little case to show you. Free radicals, chronic pain. There's the ICU syndrome that I mentioned. Severe illness, frostbite, hemorrhage, chronic hepatitis, alcoholism, drug abuse, hormone disorders, heavy metals, bisphenol A, which is a plastic, phthalate, plastics, toxins, obesity, leptin resistance. Doctor, why can't I not lose weight? I just keep gaining weight. Well, you've got leptin resistance. That's another dysregulation that has occurred. And it's very much related to what we're talking about. Starvation diets. People go on starvation diets and they can lose weight, but they basically slow their metabolism down through this mechanism. This is a very fundamental mechanism. If you really understand this, all of a sudden, all these mystery illnesses that people have and why they can't get well starts to come clearer, so you can see where this really is the point of the spear, in my opinion. And so the goal of therapy then is to restore metabolic homeostasis, to try to bring that ratio back to a more normal range. And we actually know what the proper ratio is. It should be 18 to 21 to 1, just right down there. 18 to 21 to 1 is the target free T3 to reverse T3 ratio. And over the last year or two, I've probably done 500 of these tests, and I can see it's really interesting. It kind of explains a lot when I have a patient come in and say, I don't know why I'm sick. You know, the doctor says I'm okay, but I just don't feel good, and what's going on? Well, this is one of the tests that we'll do, and I can help give them a pretty good idea now of why they can't get out of the rut that they have found themselves in, and no one seems to know what to do. It has to do with a low ratio of the free T3 to reverse T3, which is suppression of the 5' deiodinase enzyme by epigenetic dysregulator factors. So if you can tell that to your doctor the next time. So, but this is how it shows up. Then the symptoms, now if you look at the symptoms list, and I take a look at that blue sheet, and you start looking through that, and think of the people you know, or you're probably thinking of yourself because you know yourself pretty well, hopefully. And these are very, very common problems in our culture. And our culture tends to use pharmaceutics as a way of dealing with this. And I'm saying, fine, I'm not against pharmaceuticals, but I'm kind of against not thinking about what is the true root cause, and are we dealing with the root cause, or are we just putting more layers of confusion on top of the situation? Wouldn't it be better to actually try to correct the underlying causes instead of just treating the symptoms? So when your doctor says your thyroid is normal, he may actually be right. Your thyroid gland is functioning and the TSH is in the normal range, but he's only talking about your gland and its regulation. He's not, and I didn't explain this, but there is this feedback loop. The gland makes the thyroid feeds back to the brain regulates the gland through the TSH. So this is the loop. Okay, so that's a pretty solid piece of endocrinology. It's true. It's absolutely true, but it's not complete. Now, there's a couple other things. Hashimoto's thyroiditis. If you have thyroid problems, you might want to get your thyroid antibodies tested because you could have an autoimmune disease of your thyroid and still have normal TSH. So that's another thing that needs to be thought about. You could also have excessive hyperthyroidism, and that would show up. That would actually show up within the testing. So now let's look at this map. Do these all look kind of familiar? Is there any questions? I'm going to stop just for a second. Is there any questions about this map that doesn't make sense to anyone? The one thing I didn't explain was down in the right-hand corner, there's another deiodinase. It's the 5' deiodinase. Remember that the 5' takes off this iodine here, but it also takes off this iodine here. So it's what makes sure that you don't build up too much of the reverse T3. But if you're blocked here, you're also going to be blocked here. So you're not going to make as much T3, and you're going to make and you can't get rid of the reverse T3. So you can really get trapped in this loop, this dysregulation of the thyroid ratio. But otherwise, the rest of it. I also put the term type 2 hypothyroidism. There's a book out by that. And the author of that book didn't really, I don't think he had quite the full understanding, but he did know that there were people that were going to their doctor and they had a normal TSH, but yet they had a low thyroid profile. They had all the symptoms and the physical findings of low thyroid. So he chose to call that type 2 hypothyroidism, like type 2 diabetes. In type 2 diabetes, you're making insulin, but you're diabetic. How come? Your cellular receptors are resistant to the insulin hormone. Well, in a sense, this is a kind of a more elaborate explanation of thyroid hormone resistance. So if ever you want to explain it to someone and don't want to go through this whole explanation, you say, well, my cells are resisting the thyroid hormone. I'm making thyroid hormone, but yet I have all the symptoms and signs of low thyroid. And so I need some help to kind of get out of that mess. So we call that cellular hypothyroidism, which can exist even though your TSH is normal. And so this is just kind of saying what I was just saying. So one of the things that we try to do here at the Riordan Clinic, in addition to helping people improve that ratio, is start addressing the underlying dysregulators. So in other words, if we can reduce inflammation, if we can help you get rid of an infection, if we can help you detox heavy metals, if we can get you to change your diet, move away from excessive use of plastics, use maybe more organic foods, do chelation, get rid of the heavy metals, clean up your body. If you've got Metal fillings, for instance, could be a source of mercury in your body. There's things you can start to do. Now, none of these things are usually quick fixes. They are avenues of beginning to address these deep underlying causes that may take some time to correct. The other thing that we can do is we can actually begin to improve the level of T3. You know, we can make you feel a little better faster if we go ahead and work on T3. Before I get to that, this is back to these are the dysregulators here. Stress, non-whole foods, yeast overgrowth, hormonal imbalances, digestive disorders, chronic infections, missing nutrients. Really, the Riordan Clinic started because Mrs. Garvey said, I want my nutrients tested. And so Dr. Riordan did that and held a number of conferences. And so missing nutrients or low levels of key nutrients like vitamin D or vitamin C can be very important, but they're not the only thing. It could be toxicities. It could be that your digestive system is now very much out of, I've kind of put that in the center because 80% of the antibiotics in this country are sold to feedlot owners, and they give it to their cows and their chickens and their pigs. And so we're eating that, and we're getting a disruption of our own gut flora. So digestive disorders are very common, so getting those fixed can make a big difference. Focal infections, we see a lot of people, their immune systems are not working very well, so they're chronically running low-grade temperatures, or they'll have low-grade infections. Excessive things like sugar, excess sugar, fructose corn syrup solids, all those things. These are all things that can be dysregulating your body that really do need to be addressed. But the beauty of the Riordan approach, in my opinion, is that we have a starting point. And usually one of these triangles represents something that's really a problem in your life, because each one of you is going to have a different situation and a different starting point. But it doesn't matter, because once we get going, they all connect. This is a lecture that I did I think a year or two ago on, we were trying to figure out why is everyone worrying about their pot belly. Anyone worried about your pot belly? Well, it ties into this very thing. And if you follow all these arrows, you'll find out that you can even see the 5' deiodinase box there, and insulin resistance and too much cortisol because of stress and inflammation and germs and infection, and it's T3 out of balance. And so all these things set people up for the metabolic syndrome. And when you have the metabolic syndrome, your cells don't respond to insulin properly, just like they may not be responding to thyroid. They may not be responding to insulin, and so your body puts out more insulin and more insulin. And insulin is a storage hormone, and it especially stores in the viscera, the guts, around your intestines. That's where the body fat tends to build, not just in the belly wall, but in the intestinal viscera is where we get a lot of fat buildup, and that's very difficult to get rid of. But you have to bring down the insulin levels, but it all ties into this complex of things. So a lot of people say, boy, I'm hopeless. There's nothing I can do about all this. That's wrong. You can always start, who was it? Scarlett O'Hara, tomorrow is another day, something like that. Tomorrow is another day. Today is today. Actually, tomorrow's tomorrow. Today is today. And hopefully my intention for this group is to see that, there is an answer for why you might be tired. And there are things you can do to begin to shift into a higher level of metabolic activity to where you feel better. Now you can do some more exercising. Now you can get some of those jobs done. Now you can clean up your diet. There's a lot of things you can do for yourself once you start to have more energy. So these epigenetic challenges are challenging, but that doesn't mean that when the going gets tough, the tough can't get going, to paraphrase my famous football coach from high school. But that's what it takes. We have to be tough. We have to be willing to work for ourselves, but we have to have a plan, a pathway, and we have to know that there is something better on the other side of trying these things. Taking more medicines can help temporarily, but I think you have to correct the underlying causes, the root causes, to really get well, to break out of the old loops. So in the meantime, the other thing that I've done a lot of that kind of relates to this, it's not a cure, but you can improve. If you look, if the T3 level is low and the reverse T3 is high, you can give a patient a small amount of T3 to begin to shift the teeter-totter back. And that's what this slide basically says. It makes sense to improve the free T3, reverse T3 ratio in order to help the individual recover enough energy to initiate other efforts at self-care. The quickest way to improve this ratio is to add small doses of T3, 2.5 to 5 micrograms, in conjunction with nutrient replacement and detoxification. So this is something that we've used a lot of. We use natural thyroid, Armour thyroid, or other forms of natural thyroid. Sometimes we use low doses of Cytomel, T3, liothyronine, and we're able to take this ratio, which should be about 18 to 21 to 1, and if it's really low, we can slowly build it up. You got to be careful though. You know, thyroid is nothing to be playing with, in the sense that if you overstimulate the metabolism too much, too fast, it'd be like asking the freshman first day of track to go out there and run a full mile as fast as he or she can. That would not be a good coach. That the freshman could actually hurt himself trying to do what the coach said. So we are very careful. We do very careful analysis. But we do find that low doses that contain some T3 are beneficial in helping people to begin to feel a little bit better and function better. But you have to kind of do it in the context of this whole thing. Now, one of the things about taking a low dose of T3 is that you'll notice on this diagram that the T3, because it's 4 times the potency of T4, most doctors, very few doctors I know of use any T3. Some of the psychiatrists use T3 for depression, but most doctors don't use it. And the reason being is that it's 4 times the potency of regular thyroid. And the arrow, the feedback arrow back to the brain is big compared to the feedback arrow from the T4. So what happens when you take Armour thyroid or liothyronine is you get a pretty harsh suppression of TSH. You go back into your doctor, and he says, you're on some thyroid, I want to run a TSH on you. And he says, oh my gosh, it's so low. You must be hyperthyroid. And you say, no, I actually feel pretty good, but the reason this is low is because most doctors don't do T3, most labs don't test for T3, so all the normal ranges are geared for people on T4, Synthroid. And so you'll end up having a low TSH. But the benefit of the low TSH is it reduces the output of the T4 factory. And then that then cuts down on what's going to go down the other pathway. If you've reduced your T4 because of the T3, you're going to reduce your amount of reverse T3. And so the teeter-totter, which has been way out of balance, now starts to come back into balance once people start just a little bit of T3. And it's amazing, it doesn't take that much. Over time, I've found that low doses work the best. But it's always done in the context of let's improve the other things at the same time. So here's an example of a patient that I've had for many years. And you can see, it's hard to see on here, and I'm going to go to, I'll give you the numbers, but this is her lab report that I took a picture of with my iPhone. And I'm just going to tell you that the reverse T3 is way high. You can see that it's in the red. And you might also notice that her C-reactive protein, which is a marker for inflammation, is way high, 14.2. So she's got a lot of inflammation going on. So her free T3 looks pretty normal. Her TSH looks suppressed, just like I said, because she is on some thyroid now. But evidently it wasn't enough, and so I made an adjustment with her. And about a month and a half, 2 months later, you can see that now her reverse T3 is down back into the green, and her C-reactive protein has dropped from whatever it was, 14 down to 7. So we've been able to knock it down in half for whatever else we had her do. So if you actually do the calculations here, you can see that back in October, her ratio, this is the ratio calculation, we have to multiply the free T3 times 100 to get the units to match up. But this ratio back then was 6.8 to 1. And remember that the target ratio is somewhere between 18 and 21 to 1. A month and a half later, her ratio now is 13 to 1. She's still not she'll tell you she maybe feels a little bit better. She still doesn't feel great, but she feels better because we have been able to move that ratio up closer to the target range. So this allows me to regulate her thyroid more precisely. One of the reasons doctors don't like Armour Thyroid is because it suppresses the TSH, and that's normally what they use to regulate the Synthroid dose. Armour Thyroid, that doesn't work too well, but this ratio can work very well in terms of helping people regulate their dose if they're on a T3 form of thyroid. So the other thing we sometimes do see is people who come in and the ratio is low, or it can also be high. There's some other explanations. We've had some athletic people that are really training heavy. That will kind of mess up the ratio, and that may be actually an adrenal fatigue phenomenon. Some people have an overactive functioning thyroid gland due to either Graves' or Hashimoto's. That can affect it. You can usually pick that up by seeing a high free T4. Or they may be overtreated. In their zeal to really get better, some people will take more thyroid than what they really should take, and that they can actually get too much of a good thing. And so then this ratio helps me to tell them, you know, you really don't want to go too high with this. You could be overstimulated with too much thyroid. So in these cases, focusing on identifying and correcting the underlying dysregulators is really important. We can also treat those with a number of different modalities here, or sometimes they really do need a medical treatment, a referral to an endocrinologist. So I hope this is clear in people's mind. My whole intent for doing this presentation was to take what a lot of people feel is a very complex subject, thyroid testing, and define the terms so that you know what T3, T4, reverse T3, TSH, those are the key things. If you know those numbers, you can start to begin to see whether or not you're out of whack from a scientific, objective point of view. You can do the questionnaire and know if you've got the symptoms of low thyroid. And then if you need help, we're here. That's our job, to help you out. Kind of coaching, mentoring, overseeing, making sure you stay safe. We are actually, my opinion is, we're the most conservative medical institution in Wichita because we don't do a lot of surgery, like zero. We don't use a lot of medications. We use a few little hormones now and then, natural hormones, bioidentical, and we use nutrition and intravenous nutrients as our mainstay of therapy. Food sensitivity testing, chelation, a few other things like that. We have a naturopath and a chiropractor on site as well. So we're very pleased that we've been able to come this far. And I always give credit back to Mrs. Garvey and Dr. Riordan as having the vision to create this place, because you look around, it's almost like a space age center, but yet they saw the need for this, and really we're no longer unique. I mean, you know, there's a lot of people waking up to the fact that health enhancement or creating better health is a viable, at least an integrative thing that you can do along with good standard medical care. It's not an either or, it can be a both and. But in my books, it's always better to focus on what you want. So the final sentence of my presentation is focus on energy. Who doesn't want more energy? So thank you very much.